Thank you very much, and good morning to everyone in attendance today. I'd like to make a special greeting to Her Excellency, the Alternate Minister, Dr. Aga Pidaki, who I had the privilege and honor to interact with on the sidelines of the UN General Assembly last year, and a true champion of this cause of fighting childhood obesity in Greece and for the region. I'd like to also extend greetings to Her Excellency, the Minister of Health of Portugal, dear Excellencies, dear ambassadors, distinguished Greek and foreign government representatives, dear WHO representative, UNICEF representative to Greece, dear colleagues, distinguished representatives, but importantly, dear young people who are in the audience and who are joining this important meeting online. It is both a privilege and a responsibility for UNICEF to join you today to address one of the most urgent yet preventable challenges facing children in Greece, across Europe, and indeed across the world. That is childhood obesity. In the past 25 years, the nutrition community has achieved major progress to fight undernutrition. The prevalence of stunting in children under 5 dropped by 1/3, and the number of stunted children fell by 57 million. At the same time, however, overweight and obesity amongst children and adolescents have risen sharply, as previous speakers have alluded to. For us in UNICEF, a big turning point was in 2025, the year that we saw for the first time the global prevalence of obesity among children aged 5 to 19 years surpassed underweight as the predominant form of malnutrition in low-income, upper-income countries and high-income countries. Globally, 1 in 5, or a staggering 391 million children and adolescents aged 5 to 19 years are living with overweight. That's a huge, huge number. This trend reflects profound shifts in environments in which children are born, where they grow, where they learn, and where they are playing. It is driven by factors that are way beyond a child's control. The availability and affordability of unhealthy foods, aggressive marketing that targets children, and limited opportunities for safe physical activity, and huge inequalities that continue to constrain families' ability to make healthy choices. From a rights perspective, this situation raises serious concerns. Every child has the right to the highest attainable standard of health, the right to nutritious food, and the right to a safe and supportive environment for development. Childhood obesity undermines all of these rights. Dear colleagues, honorable guests, the costs of inaction are significant, not only for individual children, their families, but for whole nations, as the risk of non-communicable diseases is rising all around us. And so is the financial and social burdens on families and communities. Beyond health, the economic costs are substantial, placing growing strain on health systems and national productivity. Most importantly, if left unaddressed, childhood obesity perpetuates cycles of inequality and ill health across generations. But today we're here to celebrate. Greece has both the challenge of childhood overweight and obesity, but powerful opportunity for leadership for itself and indeed the region. As part of the Mediterranean region that is historically associated with one of the world's healthiest dietary patterns, Greece is uniquely positioned to reclaim and modernize this legacy in response to today's evolving food environments. And I have no doubt that the leadership in Greece, both in government, in academia, and other partners, will make this a reality. Importantly, The government of Greece's recent national action against childhood obesity that we celebrate today marks a decisive and commendable step towards strong and sustainable political commitment for tackling childhood obesity through a comprehensive, multi-sectoral approach that brings together health, education, food systems, and community action. UNICEF encourages Greece to continue building on this momentum by ensuring that the National Action Plan against childhood obesity remains strongly anchored in children's rights, guided by evidence and responsiveness to inequalities. In doing so, Greece will continue to demonstrate across the world how national leadership, backed by coordinated action, can create healthy futures at scale. As UNICEF, we remain committed to supporting the efforts of Greece and indeed other European nations to ensure that no child is denied the right and the opportunity to grow, develop, and thrive because of preventable conditions such as childhood overweight and obesity. I wish you all well in the rest of the deliberations today, and I will be keenly listening as we want to learn the examples of Greece and other European countries in tackling this huge challenge and how we can influence how other countries across the world are dealing with it. So thank you for the opportunity to engage and to speak with you, and wishing you all a successful day. Thank you very much.